If you or a loved one are 65 or older, you have an increased risk of being one of the 350,000 Canadians affected by atrial fibrillation. Since atrial fibrillation risk increases with age, and Canada is faced with an aging population, the amount of atrial fibrillation is expected to increase in coming years. Atrial fibrillation, also known as A Fib, is the most common type of heart arrhythmia, which is an abnormality in your heart's natural rhythm. The human heart has 4 distinct chambers, the left and right atria at the top, and the left and right ventricles at the bottom. In a healthy heart, electrical signals are generated by the heart's natural pacemaker, the sinoatrial node, and travel throughout the heart's muscles and electrical conduction system, causing the heart muscle to contract, resulting in a heartbeat. In atrial fibrillation, these electrical signals are produced not only by the heart's pacemaker, the sinoatrial node, but in other parts of the atria, especially near where the pulmonary veins feed into the left atrium. These chaotic signals cause the atria to contract in an uncoordinated manner, described by some to look like a bag of worms, impairing your heart's ability to pump blood.
So how does atrial fibrillation impact you? Firstly, patients with A Fib are at a 4 to 5-fold increased risk of suffering from a stroke. This is because the impairment of blood pumping out of the atria causes it to pool there and create a clot, which can be dislodged and block the blood vessels that feed your brain. Patients with A Fib are not able to pump blood as effectively, and this can have a negative effect on your quality of life. A Fib patients experience fatigue and cognitive difficulties more commonly than healthy individuals, which can decrease your ability to perform tasks or hobbies, decrease social interaction, and decrease your exercise capacity. While A Fib is often asymptomatic and does not cause pain, it gets progressively worse when left untreated. This leads to pathological remodeling of the heart, which makes A Fib worse, and the exercise impairment puts you at risk of further health complications. A Fib also increases your risk of developing heart failure, which significantly reduces quality of life. A Fib increases your chance of death from several causes, including stroke, but you can live with the condition for a long time when it is managed properly. So, how do you know if you have undiagnosed A Fib or are at risk of developing it? Firstly, the risk of A Fib is increased from 2% in younger people to 9% in people over the age of 65. A Fib is also commonly associated with other conditions such as high blood pressure, obesity, pre-existing heart disease, and heavy alcohol consumption, among other risk factors. There are also genetic causes linked to A Fib, so if a loved one is diagnosed, consult a healthcare professional to see if you should be screened. A Fib can occur without any symptoms, but it is commonly associated with fatigue, lightheadedness, shortness of breath, chest pain, and heart palpitations. If you have any of the risk factors and experience any of the symptoms, you should consult your doctor immediately. People over the age of 65 should also be monitored regularly for this condition.
What will happen when you get checked for A Fib? Doctors will take your medical history, including risk factors and symptoms, to see if you are at risk of having A Fib. If you are at risk, they will perform an electrocardiogram, or ECG, in order to detect potential abnormalities in your heart rhythm. Do not worry, it reads your heart's electrical activity from the outside, and there is no risk of pain or complications in this quick procedure. A normal ECG has clear, distinct waves showing that the electrical current of your heart is flowing in a normal and coordinated fashion. In people with A Fib, the place where a wave should appear to show your atrial contraction is instead a squiggly, chaotic line. This condition is very easily diagnosed by trained professionals and can be treated. What are the treatments for A Fib? The first thing that doctors will try to manage is your risk of stroke. They will do this by putting you on an oral anticoagulant, or what you may have heard of as blood thinners, which is a pill that will decrease the amount your blood clots, in turn decreasing your risk of stroke. In recent years, improvements in anticoagulants have increased effectiveness with fewer side effects, so they are generally safe to take when prescribed by your doctor. You will be monitored regularly to make sure your risk of abnormal bleeding is not too high. In less severe A Fib cases, they can be handled medically, or by using antiarrhythmic drugs such as flecainide. Antiarrhythmic drugs are simply drugs that try to restore the natural rhythm of your heart. The effect of these drugs varies between patients, so you may have to try several to see which one works best. For more severe cases, there is a procedure known as catheter ablation. Catheter ablation is an invasive procedure where a catheter is fed through your blood vessels to your heart, and the dysfunctional areas of atrial muscle are destroyed. This means that those areas are no longer producing abnormal electric signals, and the heart can return to its natural rhythm. This procedure is relatively safe and has low rates of complications. It has also shown better results and leads to better quality of life scores in patients over antiarrhythmic drugs, and the outcomes for this procedure are constantly improving with better technology and research. Between the decreased risk of stroke and returning the heart to its natural rhythm, these treatments often fully manage AFib and allow patients to lead a full life.
So what can you do to prevent AFib? The first thing you should do is get screened regularly, since it is a quick and easy procedure, especially if you have any risk factors. Maintaining a healthy, balanced diet and exercising can also decrease your risk of developing AFib. The earlier that your AFib is detected and treatment is started, the better your outcome will be. AFib has been called the silent killer because of its lack of symptoms and increased mortality, so being knowledgeable of the risk factors and symptoms can potentially save the life of you or a loved one. That's all from us. Thanks for watching. Don't forget to smash that like button and subscribe for weekly updates. See you then.